Today we are going to commence our lecture on drug calculations for pediatrics. By pediatrics, I mean children. Now, for adult dose, we have most times fixed values for most of the drugs. But for children or for pediatrics, you have to be calculating their dose based on certain parameters. The first parameter you can use when calculating the dose of a drug that has to do with children is the age. You will need the age of the child to calculate his or her dose. You also need the weight in some cases, while in some cases you will need the height. I think these are the three major parameters you can use when calculating the dose of different or a particular drug for pediatrics. Now, we have so many rules or formulas that have been formulated by so many scholars. And all of these rules or formulas are aiming at calculating the accurate dose that can be given to a child or pediatric. So I think from this aspect of the lecture, we're going to be using some of the very common rules or formulas. I think about 6 of them. But before that, let me quickly introduce this book. This is a book written by myself with the title Calculations in Pharmacology for Nurses. You can see this is the book, Calculations in Pharmacology for Nurses. Of course, it's specific to nurses because of the connections the nurses have with drugs. When it comes to the aspect of drug administration in the clinical environment or even outside, it's one of the key responsibilities of a nurse. So they are the ones that are charged with the responsibility of administering drugs. So it's very, very essential as well for them to know how drugs are calculated for children so that errors and dosing a child over or under will be prevented or curbed. So these are some of the reasons. So now, this book is specifically designed for nurses since they are the chief host, let me use that word, when it comes to drug administration. So we'll be using this as a guide in doing all the necessary calculations. So now let's start. If you have this book, the calculation starts from page 12. Starts from page 12. So this is just the first edition. Possibly maybe in the future we might have several other editions and the page might differ. But for now, in the first edition, this topic, that is method of calculating drug dose for pediatric patients, is on page 12. So now let's start with the basic rules. We have about 6 rules, or this book covers about 6 rules. And these 6 rules are the ones we'll be using as far as this class is concerned. Now the first rule or the first formula is the one we refer to as the Young's rule. That is the Young's rule. The Young's rule. So Young's rule is the first formula that we are going to be looking at. Now, we also have the second rule or formula that we refer to as the Friedman's rule. It's also a very, very important Friedman's rule. Then thirdly, we have the Dilling's rule. We have the Dilling's rule. Then fourth, we have the Clark's rule. We have the Clark's rule. Then fifth rule is the Hamburger's rule. Then number 6 is calculation based on the body surface area of the child. Body surface area. So these are the formulas or the rules that we're going to be using in calculating the drug dose for pediatrics. Now let's start with the first one, which is the Young's rule. So what does this rule state, or what does this mean or stand for? Now this rule is one of the 3 age-based rules. Now, what I mean by age-based rule is that these rules has these rules have a very strong connection with the age of the child. So it's either it talks about the age in year or years, as the case may be, or it talks about the age of the child in months. So these age-based rules either deals with the age in years or it deals with the age in months. So one of the age-based rules, we have just three of them that has connection with age. They are just three. So one of them is the Young's rule. The Young's rule is one of the age-based rules, and the rule says that the dose of a drug to administer to a child is given to be age of child or age of the child, as the case may be, age of child in years or year. If the child is 1 year, then of course it will be year. If the child is more than one, of course, becomes plural to be years. Multiply by adult dose over this age of child still age of child plus in years, of course, in years or year plus 12. So this is the formula you can use to calculate the dose of a drug for a child using the Young's rule. So this is the Young's rule. Dose of the drug you are given. And what is dose? Of course, dose is simply the amount of a drug you are administered or you are going to administer, or the dose, or dose is simply the amount of a drug. Now, what do you mean by amount? Maybe I'm to administer 50 milligrams. So this is now the amount. This is the dose. I can administer 20 milligrams. I can administer 5 mil. I can administer 2.5 mil or 2.5. So all of these are examples of doses. So dose is just the amount of a drug you are to administer or give to a child or someone. So now, according to Young's rule, it says that dose of a drug is given to the age of child in years multiplied by the adult dose over age of child in years plus 12. So this is the Young's rule. Now, if you look at this parameter, why it is called one of the age-based rules is you can see the appearance of years. Then you also need the adult dose. Now, adult dose is one of the very important parameters in this formula or in this rule. That is to say, before you apply this rule, you must know the adult dose of that drug. Without knowing the adult dose of this drug or the drug you want to administer, it will be difficult for you to calculate using the Young's rule. And not just Young's rule, all of the rules that we're going to be looking at, all of the formulas, they have a very strong link or connection with the adult dose. So very importantly, you will have to know the adult dose of any drug you want to administer to a child if you want to apply any of these rules or formulas. Now, let's quickly take an example so that we can have a better understanding. Now, take note, most mistakes students used to make when it comes to application of this formula is that this multiplication sign, sometimes they turn it to a plus sign, an addition sign. And sometimes they change the plus sign here to multiplication sign. Of course, this is not what the rule says. What the rule says is this numerator here, the plus here is not plus, but rather is a multiplication sign, while here is a sign of addition. So please take note of these errors. It can be very damaging if you make or swap these signs. So the upper part of the numerator, what we have is multiplication sign, and the denominator we have the plus sign. So please take note. Now let's quickly take the example from this book. This is the book of reference we'll be using throughout this class. Now let's take the first example. Now, what dose, that's example 1, what dose of artemether injection will you administer to a child of 5 years if adult dose is 600 milligrams? So what dose of artemether injection will you administer to a child of 5 years if adult dose is 160 milligrams? Now we have a question. Now let's take down the information. Now the first information we have here is the age of the child. We have been given that the age of child is age of child is what? Is 5 years. So the child's age is 5 years. Then the next information that we'll need is the adult dose. Adult dose was given from the question to be 160 milligram. So the dose for adult is 160 milligram. I think that are the two information that we'll need as far as this question is concerned. But let me quickly remind us. That the Young's rule is not open to all children. It's not open to all children. Now, what I mean by this is you can only apply this rule to children whose age falls between this age range. So meaning the child must be from 1 year, though there are some texts that says 2 years, but I think most of the scholars are in support of the 1 year. So meaning it's applicable to children from 1 year old up to 12 years. So that is to say, from 1 year, the child can be 1 year, can be 2 years, can be 3, 4, 5, 6, 7, 8, 9, 10, 11, up to what? 12 years. So that is when you can apply this rule. Now, if a child is more than 12 years, then this rule is not applicable to that child. Likewise, if the child is less than 1 year, that is to say the age of the child is in months, right? This rule can also not be applied. So if you want to apply this rule, the age of the child must be between 1 year up to 12 years. So outside this bracket or outside this age range, then the child is no longer eligible to be for the dose to be calculated using this rule. So please, let's take note of this very important point. So, of course, going by this statement, you will see that the age of the child here has been given to be 5 years. So, perfectly, this age can be applied. So, if you want to apply this age, since it's between the age range that we have already stated. Now, using this to calculate the dose of artemether injection you will give, the age of the child has been given to be 5 years. So that is 5 multiplied by the adult dose has been given to be 160 milligram, right? Then over what? The age of the child here has been given to be 5 again, then plus 12. So this is the substitution of the information that we have collected earlier. So now, if you go by this will give us I think 800. It will give us what? 800 over 17. At the end of it, you will have 47 milligram. So 47 milligram is what you have as the dose. So for a child whose age is 5 years, and using the adult dose to do the calculation, you will administer about 47 milligram of artemether injection to this child. Of course, since the drug comes in an ampoule, you will need to get the equivalent of this 47 milligram using some other formulas so that you will be able to withdraw it in mils. But we're going to do that later on, how to convert dose from milligram or any other strength to what? To mils. Because if I should give this 47 to you to withdraw from an ampoule, you can't do that. It will be very, very difficult. You can't do that. But you can get the equivalent of this 47 in mils where I now withdraw, and of course it will be the same with 47, but this time around it will be in mils. So this is drug calculation for pediatric, following or using the Young's rule. I believe it's very straightforward and it's understandable, I guess. Now, all you need to do is, you can have access to this book, that's Calculations in Pharmacology for Nursing. We have series of examples where you can practice. So the next rule we are going to look at in our next video will be the Friedman's rule. So the Friedman rule, in summary, is also one of the age-based rules. But of course, instead of the age of the child to be in years, this time around it will be in months. So this one caters for children who are not up to 1 year, but of course their age is still in months, maybe from 1 month up to 11 months. So that will be in our next video. Thank you very much.